Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, you can definitely WhatsApp me on 9226810 We are running a series that is called as Ayurveda in General Medical Practice, and we are discussing a lot of health problems. Last two lectures, last two topics were regarding the pain in the abdomen. In Ayurveda, it is called as a Udara Shula. Actually, any type of pain, any type of the Shula, according to Ayurveda, it's a Vata Prakopa. So naturally, we have to protect the Vata dosha, and that is with the regular lifestyle is the main secret to control the Vata dosha and to avoid the Vata Prakopak Ahar Vihar. That means the totally dry substances, keeping late at night. This is very bad for the Vata dosha. Snehana and the Svedana, oil application and fomentation are the best treatment for controlling Vata dosha. Also, Basti is the best Panchakarma to control the Vata dosha problems. So naturally, in various types of these pains, Udarashul or musculoskeletal pains or the neurological pains, you can use all these strategies that I have discussed about the Vata dosha. Actually, in this part 3, the one part which you have seen on the screen, that is worms and the pancreatitis and the renal colic that we are going to discuss. But worms that we have already covered in the last part, but still you can take it as a revision for this particular session. So let us start to discuss about the. First, I would like to make the screen little bit bigger, and then here you can see also I can wide up the screen, and then I will try to take it up. So pain due to the worms that I have already discussed few things or other many of the things in the last video. You can use the Krumi Mudgar Rasa 2 tablets 3 times in a day. Lashunadivati antispasmodic 1 tablet 3 times in a day. Vidangarishta is the best medicine for worms, especially for the children. You have to give little bit longer time, 1 or 2 months, then the tendency of getting worms will definitely be reduced. I think I have the separate videos on these Ayurvedic medicines. So you please check the playlist of Ayurvedic medicines where you will get a lot of interesting videos which have described or the discussed as a drug review. Okay. So here you can also Vidanga powder is also available, tablet is also available, and Vidanga Rishta is also available, or Asav is also available. 200 milligram 3 times in a day. Bhallataka Asav 3 teaspoon. This is also best. Bhallatak is very good to control the parasitic infection, especially the roundworm and the amoeba and the giardia, etc. But Bhallatakaso is a one contraindication where you cannot use, that is a pitta predominant prakriti or pitta predominant problems. Like for example, ulcer is there. In addition to worms, if there is a gastric ulcer or peptic ulcer, in addition to the worms, if you have the gastritis complaint or any bleeding dyscrasias, then never use this Bhallatakaso. Okay, 3 teaspoons with equal amount of water. Then you can use the Satapa Kadha. I have personally made a research on amoebiasis, and I have used the Krumi Madgar Rasa and Satapa Kadha for 1 week, and I have found that the amoeba cyst has gone from the stool infection or the stool examination. So Satapa Kadha developed from the Hari Parshuram Aushadhale, Pune pharmacy from Khadiwale Vaidya, 3 teaspoons with equal amount of water after meals. Then Kampilladivati is also available in Hari Parshuram Aushadhale, Pune pharmacy from Khadiwale Vaidya, 4 tablets at bedtime. RK pills, that is from Ayurveda Seva Sangha, 2 tablets at bedtime. Pathya, cut nails. These are very important, especially whenever there is a, what you can say, the thread worms. They are always at the anorectal region, they pour their eggs. And the children have the habit, whenever there is a severe itching, they scratch it out, and then without proper washing or hygiene, they eat by the same hands. That is very dangerous thing. So it is called as a self-infection. So always cut the nails whenever there is a worm problem. It may be children, it may be the adult. Keep check over the children because they are having the, sometimes because of the calcium iron deficiency, they eat the mud. And that particular problem is called as a pica. P-I-C-A. Remember this word, pica is a mud eating that causes the worms as well as the anemic condition. Okay. Keep away from eating outs and the hotels. Now we will discuss about another problems. Chronic pancreatitis is not the case which you can deal with the general practice because it is a specialization is required. because sometimes it gets a very severe acute attack of pancreatitis, which can be sometimes fatal. And that is mainly related with the autoimmune disease or the alcohol. So better it should be tackled with the Ayurvedic or modern specialist. Now I am talking about the renal colic. As you know, there because of the stone, there is an acute spasmodic attack of this renal colic, and that pain is always from loin to groin, from the abdomen to the groin region, inguinal region. It is always spreading like that, groin to loin. This is a typical feature, and it is unbearable many times. The people just lie down on the ground, and he's just rolling on, and severe burning is severe pain is there. Renal colic is a spasmodic pain because of the urinary or calculus or the urinary stones. So best medicine is a Chandraprabha tablet, 2 tablets 3 times in a day. Vati is a tablet. Then Punarnavaso, 4 teaspoons with equal amount of water 2 times in a day. That is the best diuretic and maintaining the electrolyte balance as well. Gokshuradi Gugulu, 2 tablets 4 times in a day with Varunadi Kadha. Varunadi Kadha is a very typical special medicine for calculus. 4 teaspoons with equal amount of water. Now, this is one prescription. I have given nearly say 5-7 prescriptions. For example, another is in acute attack, you can use Cystone tablet of Himalaya company, 2 tablets 3 times in a day with Chandana Sav, sandalwood, 4 teaspoons with equal amount of water 2 times in a day, especially if there is a hematuria or the burning urination. Next, we will go for the another prescription or the medicines group, that is Bangashila Allersin company, 2 tablets 3 times in a day with Ushira Sav. Ushir is a khas, 4 teaspoons with equal amount of water after meals. Another prescription, my dear friends, for the renal colic, Chandraprabha 250 mg plus Shankavati 125 mg plus Kurasani Ova as a tranquilizer 50 mg or antispasmodic. Then Kanaka Sundara Rasa 250 mg, Gokshura Churna 500 mg every 1 hourly. Muhurmuhu. This is a typical management when there is acute spasmodic pain according to Ayurveda. Here, renal stone, you can also use the Avagaha Swed mentioned in Ayurveda. Avagaha Swed is like a tub bath. Big tub, like our bathtub is taken or some type of tub is taken and pour the decoction. Especially this is done in the hospitals. So better you can take the patient to the hospital and do the Avagaha Swed. Okay. So here you can see that Nidra Karavati from Hari Parshuram Aushadhalaya is like a tranquilizer, 2 tablets 4 times in a day. Next prescription is a Charak company Calcuri tablet, 2 tablets 4 times in a day. Then Hajar Yahudi Bhasma, 300 mg 2 times in a day with honey. We will go further. Now, regimen, plenty of drinking water. Lot of water has to be taken because we have to make the urine little bit diluted because it is always a concentrated and that gives a lot of burning. Avoid the hot, spicy food, tomato, cabbage, onion, chuka. No. Legumes, curd should be taken in the moderation. For acute pain, use always the Avagaha Swed or tub bath is advisable. Next disease is a cystitis, that is the inflammation of the urinary bladder. What treatment you can give or the prescription? Chandraprabha tablet 2 tablets 3 times in a day with Chandana, sandalwood, 4 teaspoons with equal amount of water 2 times in a day. Then Sukshma Trifala, like a Ayurvedic antibiotic, 2 tablets 3 times in a day with Palasha Pushpa, 4 teaspoons with equal amount of water 2 times in a day. Gokshuradi Gugulu, 2 tablets 3 times in a day. And here you can say that particular Unhalayache Aushadha is typical medicine prepared from some company, 500 mg with rice water. Rice water is also best anupan in burning micturition. Next prescription for the inflammation of the urinary bladder, Godanti Bhasma, Pittagna Chikitsa, 500 3 times in a day with milk. Then Mauktika Bhasma, pearl, 50 to 100 mg 3 times in a day with sugar with milk. Then Chandrakala Ras, 2 tablets 3 times in a day. Another prescription for inflammation of the urinary bladder is here you can see Shukra Matruka Vati, 2 tablets 2 times in a day. Then Uritone from Baidyanath company, 2 tablets 2 times in a day. Ushirasav, 4 teaspoons with equal amount of water. Chandanasav, 4 teaspoons with equal amount of water you can give. Another prescriptions for cystitis, one is Allersin company, Bangashil tablet, 2 tablets 4 times in a day. Then K4 from Zandu company, K for kidney, 4 important medicines are there, 2 tablets 2 times in a day. Then you can see from Charak company, there is a Oru Clean, 2 tablets 3 times in a day, or Pathrina tablet from Baidyanath company, 2 tablets 3 times in a day. So my dear friends, in this I have discussed mainly the renal colic, worm infection, and also cystitis problem. And about pancreatitis, I warned you or suggested you, please refer these cases to the specialist, Ayurvedic or the modern specialist doctor, because at some time it can cause very severe acute pancreatitis attack, and that may be surgical or acute abdomen type of conditions, which is very dangerous for the patient's life. So it should be under control of the expert doctors. My dear friends, I always request at the end that please subscribe my YouTube channel and give the energy boosting to my efforts of giving the knowledge, sharing the knowledge. Thank you very much. Take care and see you in the next video. Take care. Thank you.